Welcome to Final BDS Made Easy. Internal anatomy of mandibular first molar is one of the 7 markers from the subject of endodontics for your final year exams. This answer is prepared from Grossman's 14th edition. The mandibular first molar is a significant tooth in dental anatomy due to its intricate root and canal morphology, which varies considerably and affects treatment outcomes in endodontics. Average tooth length and pulp chamber. The average length of the mandibular first molar is approximately 21.5 millimeters. The pulp chamber is located in the cervical third of the crown and root. It has a rectangular roof with 4 pulp horns, which are mesobuccal, mesolingual, distobuccal, and distolingual. These horns diminish with age, leading to a reduction in the pulp chamber size. Orifices and access to canals. 3 distinct orifices are present in the pulp chamber floor. These are mesobuccal, mesolingual, and distal. The mesobuccal orifice is often challenging to locate and access, requiring precise instrumentation techniques. The mesolingual orifice is found in a depression and is connected to the mesobuccal orifice via a groove. The distal orifice is oval-shaped and widest in the buccolingual direction, often requiring exploration to identify additional canals in the distal root. Coming to the roots and root canals, typically the mandibular first molar has 2 roots, mesial and distal, which are broad and flat buccolingually with a depression. Variations include a third root known as radix entomolaris. It is found in approximately 5.3% cases. The mesial root commonly curves distally, found in 84% of cases, while the distal root is straight in the majority of cases, that is 74%. Coming to the mesial root canal configurations, the mesial root typically exhibits various canal configurations like 2 separate canals exiting in 2 foramina, seen in 41% of cases, canals that merge into 1 canal exiting in 1 foramen, seen in 28% of cases, bifurcation into 2 canals exiting in 2 foramina, seen in 13% of cases, and single canal exiting in 1 foramen, seen in 12% of cases. Rarely 3 canals exiting in 3 foramina are seen, including a middle mesial canal between mesobuccal and mesolingual canals. Coming to the distal root canal configurations, the distal root commonly presents with single canal exiting in 1 foramen, seen in majority of cases, canals merging into 1 canal exiting in 1 foramen, seen in 15% of cases, bifurcation into 2 canals exiting in 2 foramina, seen in 8% of cases, and 2 separate canals exiting in 2 foramina, seen in 5% of cases. Complex configurations involving bifurcation from 1 to 2 foramina are seen in 2% of cases. Cross-sectional anatomy and clinical implications. Cross-sectionally, canal shapes vary from ovoid in the cervical and middle thirds to round in the apical third. Clinical considerations include proximity of the mesial root to the buccal cortical plate and the potential proximity of root apices to the mandibular canal, impacting treatment planning and execution. Next is the access opening and different anomalies. The access opening for the mandibular first molar follows the anatomic features of the pulp chamber. Typically, the shape is trapezoidal or rectangular with rounded corners. Anomalies such as radix entomolaris, that is extra root, can complicate treatment planning and require careful assessment during endodontic procedure. That's it. Thank you for watching. Do hit the like button and please subscribe to my YouTube channel. Stay tuned.